Hello, everyone. Welcome to episode 1 of the California CNA Test Preparation podcast. Are you ready to begin?
Okay, let's go.
Part 1. Today we will study 10 medical vocabulary terms from our medical vocabulary list with definitions and context.
1. Abduction.
The movement of a limb away from the body's midline. For example, hip abduction is the movement of the leg away from the midline of the body when getting out of bed. Context: the physical therapist instructed the patient to perform hip abduction exercises to strengthen the muscles on the outer side of the thigh.
2.
Active assist range of motion. Movement of a joint by an individual with partial assistance from an outside force. Context: the nurse provided active assist range of motion therapy to help the stroke patient regain movement in his weakened arm. 3. Active listening. Listening while communicating verbally and non-verbally that we are interested in what the other person is saying and verifying our understanding with the speaker. Context: the counselor demonstrated active listening by maintaining eye contact and repeating back what the patient had shared about their concerns.
4. Active range of motion.
Movement of a joint by the individual with no outside force aiding in the movement. Context: after weeks of physical therapy, the patient was finally able to perform active range of motion exercises independently. 5. Activities of daily living, ADLS. Daily basic tasks that are fundamental to everyday functioning, e.g., hygiene, elimination, dressing, eating, ambulating/moving. Context: the occupational therapist assessed whether the elderly resident could safely perform activities of daily living without assistance.
6. Acute pain.
Pain with limited duration and associated with a specific cause. It usually causes observable responses such as increased pulse, respirations, and blood pressure. The person may also have diaphoresis. Context: the patient experienced acute pain following surgery, which was managed with prescribed pain medication for the first 48 hours. 7. Adaptive behavior. The skills and abilities to live independently. Context: the rehabilitation team worked to improve the patient's adaptive behavior skills so they could return to independent living.
Abduction.
The movement of a limb towards the midline. For example, if a person has their fingers spread wide apart, bringing them back together is adduction. Context: the physical therapist taught the patient shoulder adduction exercises to strengthen the muscles that pull the arm toward the body. 9. Advance directives. Legal documents including the health care power of attorney, POA, and living will. Context: the social worker helped the family complete advance directives to ensure the patient's wishes would be honored if they became unable to make medical decisions. 10. Agitation. Behaviors that fall along a continuum ranging from verbal threats and motor restlessness to harmful aggressive and destructive behaviors. Context: the nursing staff noticed signs of agitation in the dementia patient and implemented calming interventions to prevent escalation. Part 2. CNA Skill 1. Now let's focus on CNA Skill 1. What is CNA Skill 1?
1. Hand hygiene, hand washing.
Meaning, the foundational infection control practice involving proper hand washing technique with specific friction patterns for 20+ seconds. Importance for CNAs forms the basis of all safe patient care, demonstrates professional competency, and prevents liability from healthcare-associated infections. Importance for patients: primary defense against pathogen transmission, prevents potentially fatal infections and complications that can extend hospital stays or cause death. Here are the step-by-step procedures for CNA Skill 1.
CNA Skill 01.
Skill 1.
Hand hygiene, hand washing.
1. Introduce yourself and identify the patient.
2. Turn on the water and adjust the flow so that the water is warm.
3. Wet hands thoroughly, keeping hands and forearms lower than elbows.
Avoid splashing water on uniform. 4. Apply a palm-sized amount of hand soap.
5. Perform hand hygiene using plenty of lather and friction for at least 20 seconds. Rub hands palm to palm. Rub back of right and left hand. Fingers interlaced. Rub palm to palm with fingers interlaced. Perform rotational rubbing of left and right thumbs. Rub fingertips against the palm of the opposite hand. Rub wrists. Repeat sequence at least 2 times. 6. Keep fingertips pointing downward throughout. 7. Clean under fingernails. 8. Rinse hands with water, keeping fingertips pointing down so water runs off fingertips. Do not shake water from your hands. 9. Dry hands thoroughly from fingers to wrists with a paper towel or air dryer. Dispose of the paper towels.
10. Use a new paper towel to turn off the water. Dispose of the paper towel.
11. Do not lean against the sink or touch the inside of the sink during the hand washing process.
CNA Skill 1 Short Dialogue. 1. Hand hygiene, hand washing.
CNA, good morning, Mrs. Johnson. I'm Sarah, your nursing assistant today. Before I help you with your morning care, I'm going to wash my hands thoroughly. This helps prevent the spread of germs and keeps you safe. Patient, I appreciate that you're being so careful. CNA, absolutely. I'll be washing for at least 20 seconds with plenty of soap and friction. You'll notice I keep my fingertips pointing down so the water runs off properly.
CNA Skill 1 Extended Dialogue. 1. Hand hygiene, hand washing.
CNA Sarah, good morning, Mrs. Johnson. I'm Sarah, your nursing assistant for today. Before I provide any care, I need to perform proper hand hygiene. Mrs. Johnson, I notice you're being very thorough with your hand washing. CNA Sarah, yes, I'm required to wash for at least 20 seconds with plenty of lather and friction. I'm rubbing palm to palm, back of hands with fingers interlaced, and cleaning under my fingernails. Charge nurse, Sarah, I noticed you kept your fingertips pointing downward throughout the process. CNA Sarah, that's correct. This ensures water runs off my fingertips and prevents contamination. I also used a clean paper towel to turn off the faucet. Mrs. Johnson, I feel much safer knowing you follow such careful procedures. Thank you for listening and studying with today's episode. Stay tuned for our next episode coming up soon.